Hey you guys, it's Nurse Teresa coming back at you with another video on how to glorify God through nursing. Another video I wanted to come on here with, and kind of rolling them out, is basically keywords in nursing. Recently my facility had implemented something similar, and I thought it was a really great tip to come on here and talk about, because I used to do it when I was in nursing school, when I didn't even know what it really was. But I myself call it keywording. Keywording is something where, basically when the patient goes home or when they check out of their appointment, they're going to get a survey sent to them, generally from Press Ganey, to see how they like their experience, what was the care that they received at the facility. They will be getting that. If your facility has access to let you see the survey, just so you can see what type of questions that they ask, that would be awesome. But if you don't have access to it at the moment, there are some key words that you can always pull out when you're giving patient-centered care, that will allow patients to realize that this was the care that I received while I was there. Because sometimes the questions, the way that they're worded on a survey, someone who's laden, who doesn't have healthcare experience, or who really wasn't kind of paying attention and was just going with the motions, because people come to the hospital, they're sick, they're not worrying about, they're not always focused on, did they bring me a pail of water, things like that. They're not always focused on that, of course, because they're at the hospital. I mean, something going on. So in order to also not just focus on the clinical side, but to make sure that their satisfaction is through the roof and they're very happy with the care that they give, pull out some keywords. So one of the main keywords that I usually love to use is your privacy. Privacy, 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 because that is a big thing when it comes to healthcare, especially HIPAA. We want to make sure that we keep the integrity of our patients constant number one on our minds. I don't care what the situation is, what level you are, whether you're a novice or you're expert, we have to make sure that we're keeping our patients on the front end of our mind. So gravitating something like, okay, can we step into this room for your privacy? Or I'm gonna close this curtain for your privacy. Or I'm gonna put this towel up for your privacy. Privacy, privacy, privacy. So that's a key word. There are so many different other keywords out there, that you can think of. Probably even Google a couple of them. But while you're in nursing school, when you first become a nurse, and while you're a seasoned nurse, if you can, possibly your best, pick out some keywords that you can utilize throughout your shift, throughout your clinic or your facility or your floor, and just make sure that you're harping on those things so that patients realize and know, okay, if the survey asks, did your nurse or your healthcare providers offer you the most reliable and safe patient privacy? They can answer yes, because they heard you say it, you said it multiple times, and you went out of your way in order to make sure that they had their privacy. So keywording is very important, especially regardless of what level you're in and what specialty you're in. Our patient's privacy is number one. So if possible, go ahead, look that up. Look into some keywords that you can use. If possible, look at that survey that the patients get so you know what to focus on in regards to their patient care. All right, you have a wonderful and blessed day, and I pray that this was something that you all needed and was fed with. And again, find any area in your life that you can in order to glorify God through it. All right, bye.